Chronic fatigue syndrome is one of the most controversial conditions around. Nobody knows what the cause is. What's true is that a lot of people with chronic fatigue syndrome have depression. The question is, which came first? Because after all, if you're feeling chronically fatigued, you're likely to feel pretty depressed as a result. Or is it that being depressed makes you more likely to experience chronic fatigue? Researchers at the Institute of Psychiatry in London have been seeking answers to these questions.
I think when we're talking about chronic fatigue, it's important to differentiate that from fatigue, which is very common in the population.
It's not just being knackered.
No, these are people who have had a really disabling level of fatigue that's there most days, that it's been there for more than 6 months, and it's very often associated with a range of other physical symptoms, headaches, aches and pains.
They feel they've got a fever from time to time.
Yes, so it's a whole syndrome of things, and we know that the people who suffer from chronic fatigue, it has a devastating effect upon their lives. Very few of them are able to work. It has major effects on their relationship. One of the other things we know about people with chronic fatigue is that when you look at a group of people with chronic fatigue, they have high rates of mental health problems, particularly depression. And of course, there's always been this chicken and egg argument.
Which is not surprising that if you're feeling this fatigue, that
well,
you feel depressed.
That's always been the problem, is it just because it's such an unpleasant disease? In the UK, there is something called the 1946 birth cohort, which is a rather extraordinary piece of work where they gathered together everyone who was born in 1 week of 1946 and have followed them up every 5 or 10 years since then with a new set of interviews. So we found that if we looked at their medical records and the responses from the surveys from ages 15 to 36, the ways before that, we found that their rates of depression and anxiety were higher than those people who didn't develop chronic fatigue. So yes, they had high rates of depression and anxiety like we expected, but that depression and anxiety was present long before they had any fatigue symptoms. If we were to look at it in their life course, the diagnosis of chronic fatigue was made in their early 50s. We know that in their 40s they were suffering from more fatigue than other people, not surprisingly, as they were building up to that diagnosis. But even before then, they had higher rates of particularly depression and anxiety.
If there's a cause and effect relationship between depression and anxiety and chronic fatigue, you'd want to know whether treating depression cuts that risk.
Well, that's true. And certainly we know that if you have someone who's depressed and fatigued, and you treat the depression, that helps the fatigue. But equally, we know that if you have someone who suffers from chronic fatigue syndrome and you just give them antidepressant medication, that doesn't seem to have any benefit. And I think probably what's important to say is that I don't think those results suggest that the chronic fatigue syndrome is a direct result of the depression or anxiety.
And what was is it like 50% of people with chronic fatigue had depression and anxiety, 100%? What was the story?
It was around about 70% of the people who were later diagnosed with chronic fatigue had some evidence of mental health problems earlier in their life. The other interesting result to sort of juxtapose against that is that we found that they were actually, those people who later developed chronic fatigue were more active than other people.
Define active.
So this was based on a range of questions. It was based on questions about how often they participate in sport, how often they exercise, and perhaps the most extraordinary result of all was at the age of 15, their teachers were asked, how active is this student in your class? Were they a child who you would class as being particularly active or just normal active or underactive? And the students who teachers rated as being more active at the age of 15 carried a higher risk of chronic fatigue syndrome some 40 years later. And so again, I think this feeds into this emerging picture about the type of person who carries a vulnerability to chronic fatigue syndrome that then in a small proportion of those individuals is at some point later activated into that syndrome developing.
And what about the overachiever theory, which is that they are active, they're high achievers, and they fizzle? Yes,
there is this notion that there is that's perfectionism. Someone who's a perfectionist, that somehow that carries an increased risk for chronic fatigue, and there is some good evidence for that. One of the other terms that's been used to describe a group who's at risk is people who are action-prone, that they're always wanting to do things. And I think there probably is something in that people who want to be very active, who are very active, that if at some point in their life they suffer a viral illness or something else that causes them to have an episode of feeling fatigued, as we all do, I think probably what differentiates these people, or what's the pathological thing that happens, is then it's in their recovery from that. It's about that ability to rehabilitate yourself in a gradual way as opposed to getting into a bit of a cycle of boom and bust with your activity. They want to get out of bed, they want to get active, then they're very active, and then they have a bit of a bust after that, and they're then very fatigued. And a cycle can very quickly develop that becomes quite important, we think, in the development of chronic fatigue. And there are no doubt other biological things that happen to people once they start to get in that cycle of boom and then bust that contribute to it continuing. We know that people, once chronic fatigue is established, we know there are all sorts of changes in their biological makeup. So once it gets established, then you're left with this mixture of biological and psychological things going on.
So how does it help treating people with chronic fatigue? Some people, there's pretty good evidence that cognitive behavioural therapy,
yes,
teaching people to reformulate their thinking about their fatigue,
yes,
helps, and that exercise helps. This research that you've just done, is there any...
I guess it helps in a couple of ways. I think things like cognitive behavioural therapy and like graded exercise therapy are partly built on this model of there being people who are predisposed to chronic fatigue, and then there being something that precipitates it, and then other things that perpetuate it. And I think this helps us understand that model more.